Hello, everyone. This is pharmacist Michael, and I'm waiting on Brianna. There she is. Hi, Brianna. I'm going to add you to the stream. How are you doing today?
Good. How about you?
Perfect. Perfect. I got your picture. You are the star of the show.
Thank you.
So now let me get my questions here.
Okay.
So, question number one is tell me about your medical condition, when you found out about it.
Mhm.
Let's start there. Hi, Leslie. Welcome in.
All right. Well, the name of my condition is non-radiographic axial spondyloarthritis. It's a mouthful, but essentially it's a type of arthritis that affects the ligaments that surround joints as well as some of the muscles.
Okay. Is it spondylitis?
Uh, it's like a spondylitis is spondyloarthritis.
Okay. I
Mhm.
probably put the thumbnail's probably inaccurate, but okay. So, how did you find out you had this?
This is probably going to be the longest part of our interview. I'm going to be honest with you.
Okay, no, that's
Because,
okay.
it was a very, very long road to diagnosis. And after doing some research, apparently it takes, on average, about 10 years for somebody to get diagnosed with this.
10 years?
On average. So that means half of the people have taken longer than 10 years. I believe from what I believe my original injury was, took about 12 years for a diagnosis. 11 to 12 years, yeah.
And what were the symptoms?
Um, well, I kind of wrote it all down because there's a long,
Okay.
long list. So let me tell you a little bit about my story and how I got to this diagnosis. Um, so I'll start off saying I feel like I have a generally high or moderate pain tolerance. So when I talk about this being pain, it's real.
Okay.
When I was 15, I had a sports injury, and I was really only treated at the time of the injury. And being young, I was like, I'll walk this off. I'll be fine. Um, but continued to feel some chronic pain in the area. It was in my glute. And about a year later, I went to physical therapy and a chiropractor. Uh, and it turns out I had torn my glute muscle and I had already had scar tissue forming in that area. So when I would sit and when I would stand, there would be an imbalance of my sides because it was only on one side. So I'd sit and that scar tissue kind of elevated that other side just a little bit. So I was told to do some physical therapy and certain exercises to help with that pain with the scar tissue. I had an MRI to check for any nerve damage since some of my pain kind of sounded like nerve pain, some tingling and achiness, but there was nothing found in that MRI. And so I just kind of did the exercises and did what the physical therapist told me to do and the chiropractor, and I was hoping to get some relief with that. About 3 years later, I started to feel pain in my shoulder and upper back, kind of in that shoulder blade area. And I again went to some doctors, and they said it could just be the imbalance. So when I'm sitting, maybe my spine, instead of sitting like this, my spine's like this, my spine is sitting a little crooked. So that's putting pressure on my shoulder. Um, I tried again physical therapy, chiropractor. There were times where I was told by doctors kind of to get my emotions in check and maybe get mental health, that it might be in my brain because everything is coming back negative, all the tests and everything like that. There, it didn't show anything. So maybe it was like emotional pain showing up in physical pain, which some people do have that. Um, but it was a little discouraging. I was thinking, "This pain feels real. It doesn't feel like emotional pain." Um, but again, I just kinda continued to live on, but, uh, that was pretty discouraging because the pain was really real, especially at night. Not every night, but more often than not, and there really wasn't a reason why. And after kinda learning to deal with the symptoms, oftentimes I'd, like, ice myself to sleep. I'd put ice packs on the parts that hurt, over-the-counter pain medications like Aleve or Advil, um, at least gave me enough relief to go to sleep, and those certain nights where it just wasn't enough, sometimes I would take, like, a sleep medication over the counter, but I was really it was depressing and kinda thinking, "How is this a way to live every day?" I'm still young, I was in my 20s, it just didn't really seem practical, and it didn't something still felt really off, to me. Uh, so a few years later, I sought out an ortho doctor, who examined me, took x-rays, and sent me to get a nerve conduction test because I was feeling, weakness and pain starting to develop in my wrist and hands. Um, I'm an artist, so and I'm right-handed, so I whenever I would do art, I would start to feel cramping and pain and all that in my hand and wrist. So I said maybe it's carpal tunnel syndrome. So they did the nerve conduction test, and that was also came back as showing nothing. Around that time, I started to also develop on the same side some TMJ problems. Um, and I was kind of told the same thing, like, I had a stressful job at the time, and I was told, get your emotions in check, try to figure out a better work life balance, try to de stress. Um,
Did more than
so,
one doctor tell you that?
yes, yeah. And different types of doctors. It could be a physical therapist, it could have been a primary care, it could have been, I think this one with the TMJ was a facial cranial surgeon that had told me that. And so about a year later, after that nerve conduction test, COVID had hit and everything locked down, and we ended up relocating to another state. Um, so, my physical health wasn't really on my mind. First of all, doctor's offices weren't really even open except for emergencies. But when I did come to the state of Florida, I sought out a primary care doctor. I've always had one. And during my first physical with him, he asked if I had any health concerns. And at that point, I'm already in tears. I hated seeing new doctors every time. I hated explaining my story. I hated explaining my symptoms over and over again. It's just physically and emotionally exhausting to do that. Um, but this doctor really advocated for me. He's like, I can tell you're emotional about this. I believe you that your pain is real, and I'm going to advocate for you. We're going to figure out what's going on with you. He gave me a cortisone shot in the area that I had pain, which didn't really help at all. And he sent me a referral to a spine specialist locally. So at that spine specialist doctor, they have multiple different doctors that deal with spine, bones, ligaments, all sorts of specialists in that building. So when I was there, the doctor took a look at my back and saw that there was a little bit of muscular deterioration. So it kind of looked like dimples, like two little dimples along my spine and my back. Um, and that's where some of my back pain was. So you notice, okay, something's going on. Your muscles are weak in this little area that you're having a lot of pain in. So I'm seeing something. Um, but when he did x-rays and MRIs, again, didn't find anything at all. And at this point, the pain started to affect my elbow, and I started to have the pain in my ankle, which I had like an injury to my ankle many years ago, and it was just very strange to see that everything was affected in places that I had possibly had injuries or that I use often. Um,
Did they ever check for inflammation?
Not at this point, they hadn't, no.
Okay.
Um, so this spine specialist said something's going on, but it doesn't seem to be anything that we kind of take care of here. I'm going to send you to a rheumatologist. I'm going to have them check you, you know, the we've checked everything. It might be fibromyalgia. And when I heard that, I was actually kind of devastated because I know that fibromyalgia is an end of the road diagnosis. They've tested everything. It's controversial that it might not even exist, that it's just something that doctors say when they say we've tried everything, this is probably what it is, but there's no test to find out and there's not a whole lot we can do for it. So I was hoping it wasn't that, but I was also hoping I need to get like a real diagnosis. So if it's this, let it be. But so I went to the rheumatologist office, and that doctor's office was also very amazing and advocated for me. Um, that doctor decided to do some more isolated tests. So we did MRIs with and without contrast in more specific areas of my pain. So not just like my whole back. They went into like did the MRI into my shoulder. They did the MRI into my elbow. They did an MRI just of my wrist and hands, to take a closer look and see what is going on. And they didn't find anything on the back or the shoulder, but they did see some of my joints in my hand and my wrists were closer than they should be, which is an early sign of arthritis, that some of that space in between the joints are getting closer and having less cushion. Um, which was a good start to see something in those images, but it wasn't enough to sort of make a diagnosis on why other parts like my back, my shoulder, were feeling pain. She said that this is kind of rare, but I'm going to do it anyway because every once in a while I have found something totally out of the blue. So she did a chest x-ray on me. And in the chest x-ray, she noticed that I had 2 broken and healed ribs, kind of in that area where I had the muscular deterioration going on. And she said that they were very old injuries, and I was athletic when I was younger, and it very possibly well could have happened at that time. Um, but she said they were very old, they had been healed. She could tell it was kind of like a stress fracture. Um, so again, that didn't really help with my diagnosis, but it does show that I had injuries in my body, that I was still feeling pain kind of in those areas. And even to this day, it's kind of unknown exactly where this might have stemmed from. It could have been one injury, it could have been um, several injuries put together, or a combination. But the rheumatologist had an idea that this might be spondylitis or a spondyloarthritis type of issue. And clearly it would have been non-radiographic in the nature because it was not showing up in radiographs except kind of for this one MRI that's a close-up of my hand and my wrist. And it was just really wild during this time because the procedures took a lot of effort on my end and my doctor's end, to get approved by my insurance. The insurance always wants to see, oh, this person, you have proof that this person has this problem. Of course, we're going to let you do an MRI, but there was no proof that I had this problem. So it was really an ongoing struggle between myself, my doctor, and my insurance company. But again, I have a doctor that advocates for me and really pushes and will even call the insurance company for me or get a hold of them. And that's what I think really helped me get this diagnosis. So the rheumatologist wanted me to go on this newer medication called Cosentyx, which is a biologic injectable medication, and it treats a few specific types of arthritis and nothing else. There's been nothing known to treat this off label. So her thought process was that if I tried this medication and it helped, it would kind of confirm the diagnosis. Um, and when I tried the medication, even after just a month of using it, I noticed a huge life-changing difference in that. So that kind of confirmed that diagnosis. Now,
How did they get that through the insurance company?
we actually didn't go through my insurance. Cosentyx has a program.
Oh, good. Okay.
Um, So basically, you just have to have a doctor that has enough reason. I'll put this light on my face. Has enough reason to um, prescribe you the medication. Let's do this. That makes it worse. There should be enough reason to prescribe you the medication, and through the Cosentyx program, I believe it's like up to a couple years they will cover you. And their program as well was very helpful. They had a nurse assigned to me through their company, so she would call and just make sure everything's going well, not to give me medical advice, but just to give me advice about the program, or if I was feeling any symptoms, to talk to my doctor about it. So that was very helpful. But unfortunately, about a year ago, I had changed jobs, and everything with insurance, I had to leave my rheumatologist office. They didn't take my new insurance. So now I'm with a new rheumatologist who is fine, but not as wonderful as my original. And so just with some issues with, with insurance, and then also Cosentyx is so new. There haven't been a lot of studies with pregnancy and Cosentyx, and I am hoping to start a family soon. So we decided to switch me over to hydroxychloroquine, which is fine. It's not as strong or effective as Cosentyx, but it works. So once I'm done having kids, I would love to switch back to going on Cosentyx. But yeah, that's basically. There we go.
There.
That's my diagnosis story and how it came to be.
Okay, so at the height of the pain, were you able to sleep?
There were many, many, many sleepless nights, for sure. And over time, I had learned to cope with some of that. Some of these things I even still use today, putting an ice pack on some of those pain points can help me go to sleep. I don't know if it just numbs everything, but I try to do things more of a natural way if I don't really want to take things like a Aleve or Advil every single day. But if I have a flare up, I will do maybe 1 to 2 weeks of an Aleve regimen just to help ease the pain. But absolutely lots of sleepless nights.
So it's getting better though. Because of the Cosentyx, do you think that made you turn the corner?
Right. And again, it's a newer medication, but there's some research showing that prolonged use of Cosentyx could also help not reverse, but slow down the effects of the arthritis.
That's good.
Mm-hmm.
Okay, Janet, Kat, Leslie, Kim, if any of you have any questions, let me know. Do you have the support you need through all this?
I do. My parents have always been extremely supportive, um, have always advocated for me, and my partner as well is really supportive. He um, understands when I'm having pain and is there for me. Um, Something that I've been doing recently to also help alleviate the pain is I've kind of changed my health lifestyle. I've been seeing a personal trainer and I go to the gym and I lift weights and I try to get strong and flexible because I know that arthritis can get worse with age. And I want to be in a point when I get older that I'm not going to be completely debilitated. And I want to be able to move as much as I can and be as flexible as I can and be as strong as I can for my future.
Have you tried turmeric?
I have. I
And
have
how
tried
did
turmeric.
that work well for you?
I think it works well. I think I kind of prefer it in my food,
Yes.
um, but I think
Okay.
it's a really good kind of natural supplement to take.
Right, and what about anti-inflammatory diet? Have you tried to put yourself on anti-inflammatory type foods to help with this?
I've actually done a lot of research on that, and I don't eat red meat and I don't eat chicken. And I try my best to do a plant-based whole food diet.
Perfect.
I also I enjoy living life, so there are times where I have processed foods or sweets, but I definitely try to limit that. I've done some research on sugar, processed sugar as well. And I do notice that when I eat, let's say I eat candy or cake or something with a processed sugar in it, I feel that tingle coming on kind of in my back and my hands. Um, for me, it kind of feels like that inflammation is coming on. So I really try and limit those. But I haven't cut it completely out of my diet because I still want to enjoy.
Right,
If I go to a movie theater, I want to have maybe some candy, or if it's a birthday party, I want to have some cake.
right.
But just knowing I'm going to limit that so I don't get that inflammation.
Have you tried, like, blueberries and, the really high antioxidant foods? Turmeric's one too.
Mhm.
Um, do you see a change when you're eating like that?
I do definitely less pain, less inflammation, um, better everything, better cognitive function, better energy. I'm a big believer in uh, you are what you eat.
Right. So Janet has a question. She said, "A workout routine must really help. What type of workouts are you doing?"
I'm doing weightlifting and some walking. Um, the weightlifting, I believe, is really helping me with my strength and being able to um, just be stronger, I guess. Yeah. Um,
Okay.
the weights have definitely helped a lot.
Is there any silver lining to this happening to you?
I suppose just physically and emotionally stronger now. Perseverance has been a big uh, silver lining. I have been able to persevere through a lot of the pain and the heartache that comes with doctors continuing to tell me we don't see anything wrong, you know, try and do these stretches, try and be emotionally healthier. um, when I knew that the pain was physical and real. So yeah, the perseverance and just kind of pushing forward and finding a doctor that advocates. Um, yeah, and finding my group of doctors was definitely a silver lining.
So Kim, Brianna has a form of arthritis in her spine that took a very long time for them to figure out what it actually was. She's she's been super active, but she had some pain, and a lot of the doctors told her it was in her head, which doesn't really surprise me because they don't know, and that's almost a cop out, I think. We've talked about this with other people that I've interviewed is, in fact, Becky, they just kept giving her more and more opiates, even though none of them were doing her any good. So I'm assuming you also learned to advocate for yourself, or maybe your parents did it. Because how old were you when you first got seen for this?
I was 15 years old when I had the first sports
Okay.
injury. But after that, my parents were supportive, but I also moved out. I had like been on my own, so I have had
Okay.
to advocate for myself starting at the age of like 19,
Okay.
20. Mhm.
So, what advice would you give to a 15-year-old that finds themselves in pain? And even if it's not what you have,
Mhm.
what would you tell them to do if they go to a doctor and they say, "Oh, you got to work on your mental health because this is in your head," or, maybe you're not coping with enough stress.
Mhm.
And they're pretty sure it's not stress at this
Mhm.
point.
I would just say, and this is for anyone for any age, just continue to advocate for yourself and find at least one doctor that will also advocate for you because they will be a life changer when it comes to insurance or giving you referrals or pushing to get more tests done. If you could find at least one doctor, any type of doctor, a specialist, a primary care, somebody that will advocate for you and help you.
So, and you didn't find that doctor until you got to Florida.
Right. I didn't find that doctor until I was 30 years old.
So you spent 15 years looking for a doctor that would actually believe you and help you find someone who could fix this problem or at least treat it adequately.
Right. At that point, it was half of my life.
15 years.
Mm, yeah.
And it was one drug
Right.
that changed everything. And what was your life like? Let's take you back right before you started Cosentix.
Mhm.
What was it like then and what's it like now? It's a form of arthritis, Kim. She has like a spondylosis in her
A
spine,
spondyloarthritis.
spondyloarthritis.
Mhm.
So tell us what's the difference between right before Cosentix and now?
Right before I was experiencing pain, and at that point, almost mentally checked out because, like, another doctor, another MRI, another x ray, another nerve conduction test, another, you know, all this stuff that's going on, and almost mentally checked out. So I was just hoping for some sort of diagnosis, some sort of relief that wasn't, I really didn't want to go on any opiates or anything like that. Um, so that was really where it kind of hopeless and almost feeling,
Depressed?
yeah, and feeling like, oh, well, this is just something I'm going to have to live with for the rest of my life, and it's getting like progressively worse. So definitely depressed. Like, I'm 30 years old. I'm in this much pain. It's this debilitating. What's it going to be in another 30 years when I'm 60 years old? What's this going to be like?
Yeah.
And that's a very depressing thought as well. Like, how long can I really live with this kind of pain constantly? But after starting the Cosentix and then also starting on the hydroxychloroquine after the Cosentix, and having that diagnosis at least feels hopeful. And I feel like I'm not crazy, like a lot of doctors have kind of not pushed me to think I'm crazy, but having that pain in my head um, is brings a lot more hope.
Did the pain go away or subside right after you started the drug?
Yeah, I was told that it could take up to 3 months, 6 months, a year. And again, just because the medication was so new, they didn't have a ton of studies. But after my first month, I immediately felt um, relief. Almost like there's always something going on with my body, some sort of tingling, buzzing, aching, pain, tightness. And after the Cosentix, it was just kind of silent. And I felt like I could just be, it wasn't any sort of um, high feeling. There's nothing like that in that medication. It's just, I felt neutral. I felt normal. I felt functioning. And that was really nice.
So was there part of you that was angry because you went through 15 years of pain when
Definitely,
you
with
found
the
out there
symptoms,
was a drug that would have worked 15 I don't know how long Cosentyx has been out, but
not that long. It's only been a few years. So
hydroxychloroquine's been out for a long
it's
time
been
though.
out for a while. Yeah. But I also believe that um, I don't think they'd be checking a 15, even 25-year-old for arthritis,
Right.
or even thinking that that would even be an option. Um, I mean, a lot of times, even not even thinking a 30-year-old might have arthritis. But I think just because I had been going to so many doctors and they kind of pushed me to another specialist and they pushed me to another specialist, at that point, they were checking for everything once I had a doctor that would advocate for me.
Wow. So, it sounds like you're doing, at this point, everything you should be doing. I think it's smart if you're trying to have a family not to take the Cosentyx,
Mhm.
because the last thing you need is, to get pregnant and then have something happen to the baby because of a drug that we don't know about,
Mhm. Exactly.
um, especially if you can function without it.
Mhm.
But I also think it's a good idea to go back on it,
Mhm.
after your child or children are born or whatever, and you want to get back to the drug that actually works the best.
Right.
Um, and you said your partner's supportive. That's probably, extremely important because it might be hard to find someone who is willing to, you know,
Right.
live through this with you.
Right. Even the
Although
little things like having to sleep in certain positions because this part of my body is hurting extra tonight. So I'm going to need to like sprawl out, or I need to have my arms tucked a certain way so that the pain is like relieved there. And I have to have this arm propped up in a pillow tonight because this side is hurting a little more. So it's even little things like that that are the support that really helps.
have you tried acupuncture?
Ooh, I tried acupuncture many years, like when I first had the injury, 15, 16, maybe 17 years old.
Did it work?
I believe it worked like temporarily. It wasn't really a long-term solution, but I also didn't do it for very long either.
Right.
Mhm,
Because I have arthritis in my lower back,
mhm,
um, and it did help me. The turmeric has helped me a lot. That's why I ask you about that.
mhm,
And the anti-inflammatory diet, I think, has helped me a lot.
mhm,
Less sugar, more what you're doing. You already knew all that.
mhm.
It is very interesting to me how a lot of people don't. They just want to take drugs, and sounds like you don't want to do that, which is, I think, good too, because I think opiates in a lot of cases make things worse.
Mhm,
They can cause hyperalgesia, constipation. If they stop working, then you got to deal with the withdrawal. You may have a doctor who decides that you don't need them anymore.
mhm,
And then trying to find another one to prescribe them can be difficult.
mhm.
But it sounds like you're you're on your way. Is there anything now that you can't do that somebody your age can do? I mean, or are you back to normal?
I don't know if there's anything that I couldn't do in the first place, but it would just cause me pain. So I'd say, okay, I'm going to do this activity, but I know I'm going to be in like a lot of pain tonight. And sometimes it's still like that. Sometimes when I do like an upper body workout, I feel it a little more in those um, arthritis areas. But my trainer has also helped me um, with some adaptabilities with that. For example, if my wrist is hurting, I have special like hand wraps that I can use while I'm lifting the weights to make sure my grip is better. So um, nothing I can't do, just need a little adaptability with a few things.
And you said you're an artist.
Hmm.
Did this affect that? I mean, when it got into your fingers?
Yeah, so I was actually an elementary school art teacher for 5 years, and I noticed the last few years of teaching, I have to make demonstrations and things like that for the kids. And after doing that, even just one demonstration, like my wrist would be in pain, burning, uncomfortable. So that did affect it. So now that I'm not teaching anymore, I can use kind of that function to make my own personal art. So it's nice to be able to do that and not be burnt out with just doing demonstrations for class.
Do any of you in the audience have any questions for Brianna? Are you Brianna or Brianna?
Brianna,
Brianna.
you said it correctly.
I want to make sure that I say the names right.
Mhm.
Kat, you're usually good for some questions. Kim, maybe they don't. Is there anything else you want to tell us? Any other advice you might have for younger people with chronic diseases?
Again, I'm just a really big advocate for you are what you eat, eating food that's better for your systems, eating to nourish your body and your mind and your system. I'm a big believer in getting exercise and keeping your strength, keeping your muscle mass, keeping your bone mass, um, helping with your cardiovascular system. And I also think that emotional support is very important. So if you maybe don't have special people in your life, like your friends or family or significant other, you can seek out a therapist and maybe get some emotional support in that way. But I think all of those are extremely important for healing and getting help with whatever ailment you might have.
Okay, I'm going to put something on the screen here because Kim keeps talking about my company. So I'm going to throw this up here. If anybody is interested in the turmeric supplement or anything else, it's up there. Brianna's already tried turmeric, so she already knows the benefits of it.
Mhm.
Um, I also think, and again, when I do these interviews, the same things come up over and over and over and over again. And one of the big ones is make sure you find a doctor, second, third, fourth, fifth, sixth opinions. We talked to Marissa, talked about that last night. That's super important because you need somebody who's either knows how to treat you, has seen it before, or willing to send you to places and believe you so they can get this fixed. So Janet says, how have you handled the depression related to your condition?
That's a good question. There was definitely a few years where I just felt very, very hopeless with, again, like we talked about, not having a diagnosis, not having medical professionals believe in your pain or advocate. Um, There obviously, when I was younger, there might have been times where I definitely dealt with that depression in a not so helpful way, but as time went on, as I matured, as I grew up, um, as I accepted things the way they were, like I said, having support with my family, having support with a significant other, and having support through friendships and counseling and therapy has all helped.
Did they try to throw antidepressants at you right away?
There was one doctor where this was, I believe I maybe was 21 years old, and I had started physical therapy again. And she's like, why don't we take some of these antidepressants while you do your physical therapy? That might help you. And I was really confused. And I wasn't sure where she was coming with that. And I said, I think I'll just try the physical therapy. And at that point, as a 21-year-old, I'm like, I'm not going back to that doctor. I'll just do the physical therapy.
Good,
So,
good.
yeah.
Because again, part of the problem with our society, and usually it's the patient, not the doctor.
Hmm.
People think that they can just pop a pill and solve all their problems, and that almost never works.
Right.
I mean, the Cosentyx work for you, but that's a little different than,
Hmm.
you know, somebody who's depressed because they have a condition. Without fixing the condition or at least decreasing the pain, the depression's not going to go away.
Right.
It's probably not due to a chemical imbalance. It's due
Hmm.
to the fact that you're in pain all the time.
Right. And that's what makes these chronic pain conditions so hard. And I think a lot of people do turn to things that maybe aren't healthy for them because they don't know how else to cope with that pain. And it
Right.
ends up being a big cycle.
Yep. And most of those things make it worse in the long run. They don't help.
Hmm.
People turn to alcohol. It may deaden the pain for a little while, but you're doing more harm to your body,
Right.
more oxidative stress. So you end up in worse shape. I may send her a bottle of that, Kim. I may send her a bottle of that just to see if it helps her.
Hmm.
I've got an ultra joint flex that Kim takes. She's got some issues where she takes a lot of my products. So I may send you a bottle just to
Okay.
see, it may help you. I mean, I don't know. That's my doctor. He always wants to pop pills, depression pills when you go there for pain. And it's gotten worse because now they're not supposed to use opiates anymore, except for short-term relief and cancer.
Hmm.
So what are they going to give you? Oh, you're depressed. Let's give
Yeah.
you. Oh, Lisa. Hi, Lisa. Do you have any questions?
Which antidepressants is great for a lot of people. A lot of people do need them, but
Yes,
there's a lot of people who don't.
that's right.
And they could just do more harm, like you said, just kind of numbing the pain or covering up what's going on. It almost feels like the doctor just wants to give it to you to kind of shut you up. Um, and that's definitely not helpful at all.
Really, the secret, especially if you have something that doctors are not used to seeing,
Mhm.
is keep looking until you find the right one.
Mhm. Yeah. And that can be discouraging for some people too, because not
Yep.
everybody has a good insurance where they can just pay that copay and hop around with doctors. That's a whole nother story.
Well, she was taking Cosentyx, Lisa, and that basically helped her get over most of the pain, but she wants to have a family, so she switched. And now she's, oh God, what are you taking again? I already forgot.
Hydroxychloroquine.
Hydroxychloroquine, which, if you guys remember, that was one of the drugs they were talking about for COVID at the beginning.
I believe it's like originally an anti-malarial.
It is,
Mhm.
yes. but they do use it for arthritis.
Mhm.
And so what's the difference between Cosentyx and the hydroxychloroquine? I mean, how much difference is there in the pain relief? Is it huge? Just a little bit?
I'd say the Cosentyx gave me a good, like, 90% relief, and the
Okay.
hydroxychloroquine probably gives me 50 to 60%.
Okay. So there's quite a bit of difference.
Mhm. But 50% I'm happy
Yes.
with because I've also, throughout the years, have kind of learned these coping mechanisms for handling my pain. Um, like I mentioned, with ice and a leave regimen when as needed, not often, but and then again, everything else that I do, exercising, changing up my eating habits, things of that nature. Um, but the hydroxychloroquine is just a pill that I take
Right.
twice a day, and the Cosentyx was once a month injectable biologic.
Right.
Mhm.
Kat, the what she's trying to do is protect the baby if she does get pregnant. And so she doesn't want to use a Cosentyx because we don't have enough evidence yet.
Mhm.
It's too new. So that's the reason she switched to hydroxychloroquine. I can't even talk. So
Yeah, there's not there actually I don't believe there's really any studies with pregnant women
right.
on Cosentyx. So it's very possible that there could be no
Right.
effects at all, but you'd have to be willing to take that risk, and they really
I wouldn't do it
yeah, they
unless
really
you
have to
absolutely
not
had
do
to.
that.
Yeah. No, I don't think you want to become the study subject
Right.
in that case. Any more questions for her? I think your story is fascinating. I do. I'm very glad that you came on. Um,
Thank you for having me.
I,
It's interesting to tell my story now and not having to be in tears telling a doctor what I've gone through and
and
telling it
it's
to be educational.
and it's true. You know, it's easy for me to say keep going to the doctors, find another one, find another one. But you're right. You get tired of telling the same story. They run the same tests. You already know it's not going to work. And then, you know, one difference between you, though, and some other patients is some people do want the pain meds, not because they're addicted to them, but because they want to get rid of the pain.
Mhm.
And then you get this stigma put on you. Oh, God, here we go again. We got another one of these that's just trying to, you know, get pain when there's nothing wrong with them. When clearly
Mhm.
there was something wrong with you. It's just you had to find the right doctor to
Mhm.
figure out what it was. So, you know, I applaud you for doing this without pain meds. I think that's wonderful.
Mhm.
Um, sounds like you found the right guy. That's wonderful.
Mhm.
You you look happy. You don't look like you're in pain now. I know sometimes you can learn to hide it pretty well, but
And that's definitely been a struggle as well. When I always kept my pain to myself, except really for my parents and maybe anyone who like lived with me. But a struggle too is telling people about my story and like, oh well, you look healthy, like you look fine, or people I work with will say, oh, I didn't even know there was like anything wrong with you when
yeah.
there is. So you never know what someone is going through, what they're struggling with, because some people might just hide it really well.
Did you find your mood changing when you were working and you had a bad day as far as pain went? I mean, did you get grouchy? Were you short with people? Did you act any differently?
Um, there definitely have been times, and not just like at work, even with life, with people close to me. If I'm having a painful day, I might be a little more grouchy, just like any other
Right.
animal.
Yes,
Dog's
yes.
in pain, it might bite you. Kind of the same with people. I'm not going to bite people, but
Right.
I might be short tempered or something like that. That could definitely, that could
And
definitely
the
happen.
The reason that I asked you that is because a lot of times when somebody's rude to us or mean to us or says
Mhm,
stuff to us that is less than ideal,
mhm,
we immediately think they're jerks or they're mean or
mhm.
they don't like us, when in reality, we don't know what's going on
Yeah.
with them.
Mhm,
It could be something like you, but they could have had somebody in their family just die, or, there's a lot of things that can happen to people. So, I always try to give people the benefit of the doubt
mhm.
when they're rude or mean or, because people don't want to tell you they're in pain sometimes, or they don't want to tell you their grandma just died because it makes them feel worse.
Right.
So she used it. What is hydroxychloroquine? It's an anti-malarial drug that we also use for arthritis. Okay, Brianna, thank you for coming on.
Thank you for having me.
And I am going to get your address because I want to send you a bottle of this Ultra Joint Flex
Okay. I'll definitely give that a try.
just because you came on here. And Kim is going to tell me to send it probably 20 times if I don't. So I will do that. And then maybe we'll have you back on here when you have a little family.
Yeah. A little
That
update.
Yeah, that would be wonderful. I would really like that.
Mhm.
Okay. Thank you.
Thank you
Thank you
again.
again. Thank everybody for coming. I
Yes,
really
thank you
appreciate you
for all the
guys.
questions, all good questions.
Yeah, thanks for the questions. And I'll be back tomorrow with a whole nother story for you guys. Bye, everybody. Be happy and be healthy.
Bye.
Bye.